Well, my name is Ken. I'm with Oskaloosa News, and it's a pleasure to meet you both. We'll start off with brief introductions, and we'll start over here.
Yes. So I'm Trish Millner. I'm one of the new family medicine and obstetrics physicians.
And I'm Eric Wood. I'm also a family medicine obstetrics physician.
Well, so let's get to know you both a little bit better. If you could kind of tell us a little about yourself, what you feel comfortable in the public knowing, family, where you practiced at, all that different stuff.
So I originally did my training in D.C. at Howard University, and then I joined the military. So I did my residency and my fellowship at Darnall Army Medical Center in Fort Hood, Texas. I was a faculty member there after fellowship and also a faculty member at the Triplet Army Medical Family Medicine Residency Program in Honolulu, Hawaii, right before I came here. So it's very cold here, and that's we're adjusting to that. But I also specialize in high-risk obstetrics. I'm married to a very handsome gentleman, and I have 6 children. Recently, I had 2 6-month-old twins. Very much looking forward to being ingrained in the community here.
And you, sir?
Hi. So I'm originally from Oklahoma. I was a school teacher and an elementary school principal before I went to medical school up here at Des Moines University. I trained at Broadbonds in Des Moines, and I'm originally from a town about the size of New Sharon in Oklahoma, and I wanted to come back and do rural medicine after residency, and had great opportunity here at Mahaska Health to join a great practice.
Well, I just spent a little time last month with a couple of your colleagues that share this space with you, and I guess they call it a pod. I think there were a couple of memes that floated around on the internet about pods and maybe birthing now. But, so what do you feel like, this particular addition to the hospital, the vital resource that it helps provide the community, and the health and wellness that's here? So, we can start off here with your thoughts.
This is Eric's pod, so I'll let him talk about it.
Yeah, so over here, in this new section that's super nice, hospital, remodeled for us with four new OB and family medicine docs coming. It's great that we can take care of entire families from birth to old age here, right in one location. We see pregnant mothers and their husbands and their children and their parents and grandparents, and I think that's wonderful to be able to do all right here in one spot.
Pretty much the same thoughts that is it kind of a unique sort of situation that's I think you all four are familiar with each other or something.
Yeah, well, I think the camaraderie that we had just coming into it, I think, we all took the job at least a year out knowing that we were coming here, and so we were able to establish a rapport with one another before we even got here. And Kevin has been great. Our boss has been great at making sure that we were communicating with each other, and so that there was no pressure to perform, and it was just an ease of working with each other. I feel like I've known them for a while, even though I just met them physically. So I think, and then being able to work in the same vicinity with each other, we can say, hey, Eric, I have a patient who has X, Y, and Z. What do you think I should do? Or and vice versa. Having that subject matter expertise in this area, and then not knowing something I know confidently, I can go to my colleagues and they can help me out as well.
Yeah, I'd say that's a pretty important one.
Absolutely. There are certain aspects of women's health that Dr. Millner does specifically that some of us don't do over here in this pod, including colposcopies and everything, and we try and send those to Dr. Millner and our high-risk patients. She kind of follows with as well. But it's a great opportunity to come here. I trained with Dr. Sarag, who's kind of who is a hometown boy here, and
hometown hero.
Yep, one of the main reasons I'm here, and he's talked great about Oskaloosa and been a very good representative for you guys.
Well, I was going to say you were an Oklahoman beforehand.
I was.
And my uncle lives there now. He's been there for many, many years. And You don't like the cold, so are you adjusting well to the cold?
So this is my 8th year here, so I'm pretty well adjusted. But you can always put on more layers, and there's only so many layers you can take off before somebody calls the police. So,
Very true.
Yeah, so it's I'd rather have the cold than the heat in Oklahoma.
Right. So
I'm actually the opposite. Coming from Hawaii, I much prefer to be hot. And one of my younger daughters has never even seen snow, so she's like really excited for the winter and for the snow. Although I am not, but I grew up in Delaware, so it's the same kind of weather. 4 seasons, very cold, lots of snow. Yeah.
Your daughter will get her fill of snow.
I heard. Yes.
So folks that are coming in here, they're getting a new doctor. I mean, OB is, of course, a big deal, particularly in rural hospitals like Oskaloosa. I mean, that's a service that's getting harder to find, and this hospital has invested in that. So how do you make those people comfortable? How do you get new patients in here and, you take them through day one, like, hello, my name is doctor, and then, to where they're finally comfortable and you really get down to the root of the problem?
I think for me, usually when I first meet a patient, regardless if they're OB or not, but especially if they're OB, I take time to introduce myself and let them know a little bit about me. Usually the icebreaker is, hey, I'm new to Oskaloosa, and I came here from Hawaii, and it's always, why would you come here to Oskaloosa from Hawaii? And so trying to give them some background about me, letting them know that it's an equal partnership, and you can know about me because I know a lot about you personally. And then kind of just establishing what their expectations are for their pregnancy, what it looks like for them. And then I have my own diagram in my brain of what I do for every OB visit. So I just adjust it based on if they're high risk, if they're low risk, if they have a long birth plan, if they have no birth plan at all, if they've had a lot of children, if they have no children. It really all depends on what the patient comes to me with and what their expectations are, and I kind of try to fill in the blanks from there. And Dr. Wood is probably different.
Well, a lot of it is super similar. We try really important to provide patient-centered care. We want to honor the wishes of our patients at all times, as long as just as much as possible. But yeah, it's always great to get to meet new patients and new families.
So who's the one that likes exploring Iowa? I was reading some bios.
So I definitely like to. Yeah,
you like to do that?
I definitely do. My family, we like going on road trips and seeing small towns, and we've been to all 4 corners so far, but there's still lots more places to explore.
Well, Mahaska County has had over 100 communities in it. Most of them, of course, are gone now.
Yeah.
But is there a place that you've visited so far in Iowa, someplace else that you can probably say, that was my favorite to explore?
So up in the Dreyfus region, Decorah is gorgeous, and I was my wife and I were big gardeners back in Oklahoma when we had more a larger garden, and we were members of Seed Savers Exchange that's out of Decorah, which is a nationwide seed saving operation, and we always wanted to go up there, but it was 9 hours from Oklahoma at least, and so it was always too far to travel for us. But that was one of the first things we did when we got here. When we moved to Des Moines, we went to Decorah. So yeah, it was great. Tomato tasting.
Tomatoes?
I love tomatoes.
No? We'll not get along there.
My last garden in Oklahoma had over 100 tomato plants. So
there's a lot of tomato lovers. I have married to one as well, but so I'll pass. I'm just curious though. Kind of back on a little more serious note. I spoke with your 2 colleagues and we talked about providing wellness to family members, community members beyond the OB and things like that. And how important do you see that? For the community's well-being as a whole. So we're in the middle of a pandemic. All of these things come together. Kind of everybody wants to feel a little safer and more secure in their lives. And to kind of help us understand how your jobs help fulfill that.
I think the hospital here is like it's like the center of the community almost, because a lot of life passes through here, both at the beginning, at the end, and we also provide a lot of awareness, like updates from the CDC or vaccination guidelines or preventative medicine. A lot of that flows through us, and that we can take care of the community. A lot of times we can also provide information to patients that isn't necessarily related to their medical care, in the form of like social work. And I think we also work with like Crisis Intervention Center and Love Inc. to work with patients that maybe financially can't afford things or need transportation. We provide a lot of services like WIC and like assistance for food for families that can't afford stuff like that. So I think just coming into the hospital, you can be available to a lot of the resources that most women and families think they might not necessarily get here, that we've kind of set up connections with outside organizations, including the colleges, the local colleges. We service a lot of the athletes, a lot of the local businesses like Musco. We service a lot of their employees. And then we also do a lot of charity events for like the homeless or health drives, Thanksgiving food drives, and I'm kind of blanking on anything else. Yeah. We do a lot for the community.
Well, yeah, I think one of the main draws for a lot of doctors that want to go into rural medicine is, providing care to underserved population. It's becoming increasingly difficult to find doctors in rural areas, OB doctors in particular, and also mental health providers too, which we try and address from the family practice sort of side, coordinating mental health care as well. It's super important. But I think a lot of doctors that want to go into rural primary care like we are really want to help, the rural parts of the country. So that's one thing that was really important to me.
I think you're the bicycle rider?
Mm-mm.
No?
No, I'm not a bicycle. I'm a runner. But
yeah, no.
The runner?
Yeah, I'm a runner.
You like to run?
No,
Okay.
But in the Army they made us run, so it just become a way of life after a while. You just don't get used to running 2 to 3 miles a day, and that's it.
Well, I was curious a little bit about your military experience, and what grade did you leave the military as?
I left as a major. It was just time to focus on more of the kids and a career outside of the Army. I deployed in 2018 to Afghanistan, and I think it was around that time when I was sitting in a bunker that I was like, this might not be what being a doctor is all about. So I really enjoyed my time in the military. I would not trade it for the world. I've made lifelong connections with friends, and they've become my family, and I went all over the world, and I'm a veteran, and it's just being in Oskaloosa is a different vibe now. Now I'm more family oriented. I don't have to wear a uniform. I don't have to say yes sir, yes ma'am. And so it's it's a pleasant different, but it's just different. Mm-hmm. It's definitely been a transition.
Well, thank you for your service.
Thank you for your support.
Well, I'm going to close this out by giving each of you an opportunity. If you have anything that I haven't talked about that you feel as though it's important to address.
Yeah, I think just the thing about Mahaska is a lot of people don't know about the great other service lines that we have here. As a family medicine group, we still work hand in hand with the radiology department. We have a full service 24-hour ER here. We have physical therapy, occupational therapy. We have orthopedic surgery, general surgery. We have dietitian, nutrition, diabetes education coordinators here. We have inpatient services. We have a full labor and delivery unit. And there's tons of other ancillary services that we have here. So even though we're a community-centered hospital, we do have a lot of resources available here versus a lot of other hospitals have to refer out on everything. We have specialty doctors that come down from Des Moines once or twice a week, nephrology, hematology, oncology, and we also have an infusion center here that people can get their chemotherapy and transfusions done here as well. So that's something that we're very proud of, and that our Boss's vision has been to expand service lines, and that's what we're doing here, and also with OB as well, hoping to increase our numbers with the number of physicians that we have brought on.
Yeah, and I just want to say we have the people that you're going to interact the most with when you come here to the hospital, our front office staff, our nurses, and our care coordinators are all wonderful, and they want to take care. They're here just like we are to take care of patients and focus on that. So I want to, that's who our patients interact with more than them when they get to spend with the doctor, and they're all great here as well.
Yeah, I really do appreciate you guys.
No, thank
Yeah.
you for having us.
Glad to
Appreciate
do
it.
it.